Steve is the founder of Bay State Physical Therapy and Milton Chiropractic and Rehabilitation. He's a 1985 graduate. Sorry, Steve, for announcing the year, just in case you didn't want me to. A 1985 graduate of Sargent College's physical therapy program. He also received his doctorate of chiropractic from New York Chiropractic College. Steve opened up his first private practice in Quincy, Massachusetts in 1990 with a very firm belief in a manager-partner model. He since then has established more than 70 clinics, physical therapy clinics, and 13 chiropractic offices in 4 states, Massachusetts, Maine, Rhode Island, and New Hampshire. Steve is a member of many physical therapy and chiropractic organizations, including the past president of the South Shore Chiropractors Society. He's lectured extensively at local colleges, businesses, and community organizations on stress reduction, nutrition, and exercise. And he believes in a well-rounded approach for achieving optimal health. Steve is the recipient of the International Chiropractor of the Year Award from the Masters Circle Incorporated. Steve, thank you so much for being here with us tonight. It's been a pleasure really to get to know you over the past couple of weeks in our preparation for tonight's talk. I hope everybody enjoys his company as much as I have.
Thanks, Kelly. I really appreciate being here.
And of course, I have to comment, I love seeing TB12 over your left shoulder, and I know I've said that in the past. Okay, so let's talk a little bit about your journey at Sargent, your decision to become a physical therapist, how you came about to decide to become a physical therapist, and then your plans after graduation. So take us through Sargent education and how you came to decide to start your own private practice.
Sure. So like many physical therapists, I was a high school athlete, injured. My dad was a local professor at a local university. And once I got injured, he picked me up off the basketball court. I turned an ankle real bad, never injured myself before. He had become very close friends with the head athletic trainer at the university, and got me in to see him very quickly. Now, the dynamic there was the trainer was about 10 years older than me and about 20 years younger than my dad. And he was just this really neat guy that I got to hang out with while he was rehabbing my ankle. And we just started talking about life and what I wanted to do. And, I told him that I was definitely interested in the medical field, but couldn't see myself going to medical school. It seemed too daunting at the time as a 14 or 15-year-old.
Yes.
And that I was thinking about, I'd like to work with folks and so forth. And he suggested that I think about becoming a physical therapist. So he's the first person who planted that into my head, saying, hey, look, you can work with athletes like yourself. You can get people to, get better. And it's a really cool profession. And so that's kind of how it started. So my sister actually was going to Boston University. So I had a chance to visit and really liked it up here. And so I remember applying, but I applied for health sciences. And when I came to visit and I was doing a tour of Sargent and just happened to speak to somebody and just said, yeah, no, I just checked the box that said health sciences, not PT. They said, no. It's very specific. You got to make sure if you want PT, then we've got to resubmit your application. I said, okay, then do that because I want physical therapy. And they said, okay, call us on May 1st and we'll let you know if you got in. And so I remember walking home from high school that day and got home, dialed the Sargent College and they picked up and I said to myself, well, if they say yes, I'm going to go to Boston University and go to physical therapy school. If they say no, I'm going to go to Brandeis and play basketball. I was recruited to play basketball there and really didn't know what I was going to major in, maybe athletic training or something, but not PT. And I was like, I don't know how I'm going to figure that out, but I'm just going to leave it up to kind of the universe. And as it turned out, I got into the PT school and went to Boston University to be cut by Rick Pitino twice trying out for the basketball team. It's a side story. My ADD is kicking in. I apologize. So went to BU and midway through my probably my sophomore year at BU, my dad calls me up and says, hey, I think you should be a chiropractor. And I'm like, what are you talking about? I'm in physical therapy school, Dad. He goes, no, I know. He goes, but you've got great hands. He goes, I just I just threw my back out, went to a local chiropractor. They took great care of me. He goes, I don't know, I could just see you doing this. You can own your own business. And I don't know, think about it. And so the next day, I went down to my BU professors, Pam Levangie, Prudy Marcos, Pat Sullivan. Like really, these are like high-end, heavy-duty, rah-rah PT professors. And I don't know what I'm doing. I'm just saying, hey, I'm thinking about going to chiropractic school. What do you guys think? And it's as if I had three heads. They looked at me like I was crazy. And so they said, we think you should finish PT school. And so I took their advice. I finished PT school and, didn't grow up with a lot of money. And so I always worked hard, and summer jobs were real important, and wanted to use my time to be as effective as possible in making money. And the best job during the summers in Boston was renting apartments. So I got a job my junior year renting apartments and made a ton of money. And so the summer of my senior year, after I graduated, I pushed off my last clinical affiliation so I can make a boatload of money renting apartments. And that's what I did. And then I started my first job at Beverly Hospital in Beverly, Mass, making $9.85 an hour, ambulating little old ladies up and down the hallway. And I remember I woke up one day in a sweat going, what am I going to do for the rest of my life? How is this going to work? And it just came to me like I should go to chiropractic school. I literally didn't know a thing about chiropractic. I'd never been to a chiropractor. The only thought I had was for my dad. Now, my dad was one of those guys that was sort of ahead of his time. He was, he was meditating. He was running before people were running. He was a vegetarian before people were vegetarians. He was a black belt in Aikido. He had this kind of Western Buddhist kind of mentality. And obviously I got some of that. And so I called him up that day when I woke up in a sweat and I said, hey, can you send me some information about chiropractic school? He's like, I don't have any information. I go, can you go to the school and go get me some information? And so he ran over to the school, which was on Long Island where I grew up, and he mailed it to me. And I just made a decision. I said, I think I got to go to chiropractic school because I just can't see ambulating little old ladies up and down the hallway. I knew I wanted to own my own business. I knew I wanted a private practice. I just couldn't figure out how to do it as a PT. But I thought if I combine those, the worst case scenario is I'm going to be this really skilled PT that knows how to manipulate joints, but I can hang my shingle. I can have my own business. I thought that was at the time, I thought it was a good idea. And so I moved to New York, took the prereqs, started chiropractic school. And the first day of chiropractic school, they put the new class in a room, and they have some folks come up and talk to you, and they really kind of orientate you on what you just got yourself into. And they started off by saying, hey, look, what chiropractic is really just allowing the body to heal itself, that we're all born with the energy and the power to heal ourselves. Like when we cut our hands, eventually the blood will clot and the skin will reform. As long as the body doesn't have any interference. And the way chiropractors look at it is if there's interference, especially in the nervous system where the joints in the spine line up, if we can remove that interference, that the body will have a better chance to heal. The basic premise, what I heard that day was, as chiropractors, we want to try to avoid surgery and avoid pain medication. And as a physical therapist, I felt the exact same way. I didn't want my patients to get on more meds than they needed. And if we can possibly avoid surgery, great. And then personally, my personal philosophy is I never took any drugs. I was one of the straight-laced kind of kids. I still don't take any drugs. I'm not on any prescription drugs. And so philosophically, it just kind of fit my life. So went to chiropractic school, which turned out to be fairly easy because I had taken most of the coursework already at BU. So I was taking gross anatomy for the second time and all this other stuff. And so I was able to work 10 or 20 hours a week learning how to do these manipulations. While everyone else is in school, I'm actually out with real patients doing the manipulation. So by the time I graduated, I was really ready to go. And so in thinking about where to open a practice, during chiropractic school, got engaged, and my wife grew up on Long Island. I basically said, we're not opening a practice on Long Island. There's about 7,000 chiropractors on the island. We finally eventually decided to move up to Boston. And the idea was combining the practice of chiropractic and PT was just not something you saw in 1990. So first practice was in Quincy, Mass in 1990. And we got off to a very fast start. We were supposed to open the office on a Monday. And on the Friday before, we had 3 new patients. And so we knew this was going to be a really solid practice. Within a short period of time, I was able to hire other chiropractors and PTs to work with me to have this kind of combined practice. And 5 years into it, I had a couple of chiropractors that I became friendly with ask me to open a PT office with them. They had the space, they saw what I was doing, they were interested in combining the both, but they couldn't do it without a physical therapist. And since I was both, they asked me to do it. And my functional ADD kicked in, and I said, sure, let's open a PT practice. And it was an absolute failure for 2 years, and to the point where these guys came to me and said, hey, can you find someone to buy out our shares, because this isn't working for us. And so I had a young therapist working for me at the time. I asked him if he was interested in partnering in with me, and he said yeah. And he rubbed 3 credit cards together, bought those guys out, and within 3 months the practice took off. And a light bulb went off for me. And what I noticed was, when someone was a managing partner, meaning they had actually put money on the line, their feet were on the fire, they'd show up early, they'd stay late, and they'd make sure the patient experience was fantastic. And so we've literally taken that model, made a lot of mistakes, corrected a lot of those mistakes, and over the next 25 years, we've been able to grow it to now that we have 80 physical therapy offices in 4 states. We have 16 chiropractic offices, and I have about 30 managing partners. So it's been, just a kind of series of events that it would be hard to piece together to get to where we are now. But those are all the kind of things that happened for us to be here, I guess.
Yeah. So you had some successes, you had some bumps in the road.
Plenty.
Amazing story. For those of you that don't know Rick Pitino, which Steve mentioned briefly, is one of the greatest basketball coaches to have ever coached. And even though Steve got cut, what an honor to say I was cut by Rick Pitino.
Twice.
So
BU was his first head coaching job. His now these are for the basketball people, sorry. His assistant coaches were Bob Brown, whose son is Brett Brown, who just got fired from the Philadelphia 76ers. He was their head coach. Brett Brown was also the point guard at BU at the time. And his other head coach was John Kuster, who was also a head coach in the NBA. So these are guys I was hanging out playing pickup ball with and just having a great time with. So it was quite a time.
Such great. So not only great memories at Sargent, but great memories of athletics. So just really quick, I want to remind everybody tonight's talk is being recorded. If for privacy reasons you want to keep your camera off, we totally understand. We do love seeing your faces. And if for privacy reasons you want to change your name to anonymous, we also completely understand. We've also, to go along with the theme of our fireside chat, everybody that has registered tonight will receive a tea bag in the mail. If you already have it, I hope you're enjoying a cup of tea with us. If you have it, please take a moment for self-care when you do, and have a cup of tea on us and just think about your wonderful memories at Sargent. Okay, so let's go back. I can't believe it's been almost a year. Everybody remembers where they were on 9/11. And I think now everybody's remembering where they were on that day when we found out COVID-19 is real in the United States. And we were going to have to shut down. Where were you when you found out? Where you came to the realization that, you know what, I need to make some changes in my clinics. And how did you make it work where you were able to stay open for acute care cases?
So I was in Aruba. My wife and I go to Aruba twice a year, or we've been going to Aruba twice a year for the last 15 or 16 years. And that has to do, again, with basketball. We'd go before the season starts in November and after the high school season ends in March, before AAU season would begin. And so like every other March, we were down in Aruba for an extended period of time, family down there, some for not such a long period of time. And, things started happening, right? You started hearing things, and I'm taking phone calls, and it's getting worse and worse. And finally, Sunday, the 15th, I think I'm leaving on Monday anyway. But on Sunday, the 15th, one of my biggest landlords, who's also a friend, calls me up and says, we're going to be closing the gym. And I just wanted to give you a heads up. And I mean, this is one of our biggest offices. And at that point, I knew things were, I think that was on Saturday, he called me. And I looked at my wife, I said, I got to go home tomorrow. And so I went home that Sunday. That Monday morning, so normally we have, our leadership team meets once a week for 90 minutes. We had a, kind of an emergency meeting that Monday morning, of all the leadership team, probably lasted 2 or 3 hours. And then we kept that morning meeting. We did that for 27 days straight through the environment. On Tuesday on my way home, so this is the 17th now, this is, all around us, people are testing positive, there's all kinds of, nobody knows really what's happening, but things are starting to get shut down, people are testing positive, people are getting sick. And so the real questions are, should we shut down? Should we stay open? Like, how is this all going to work? And so in a short amount of time, our team really needed to make a decision. I remember on the drive home, I just said, we've got to do telehealth. And there's a backstory for me for telehealth. So in the previous years, there's some vendors out there on the PT market that would approach me and say, hey, you interested in telehealth? And I would say, why would I be interested in telehealth? There's no use case for telehealth in our business. This is a hands-on business. People come to see us to get stretched, to get manipulated, to do hands-on PT work. We need to be with our patients. There's no use case for it unless you're in a very rural environment and people just can't travel to wherever the clinics are. But we don't have that issue. We're in a pretty dense environment. People can get, and we have lots of clinics, so people can get to us. So I didn't see the need for it. Well, that Tuesday, March 17th of last year, I drove home and said, we've got to get on telehealth, and we've got to do it as soon as possible. And so Wednesday morning at our executive meeting, I looked at my VP of operations and my director of operational excellence, and I said, hey, our home exercise program has a telehealth app that goes along with it. I said, you need to learn how to use that today. And tomorrow, Thursday and Friday at 1 o'clock, you need to teach all of our PTs, which is about 200. I said, do it via webinar. And on Monday, we're rolling out telehealth. And on Tuesday, from 5 to 6, schedule a Q&A, because we know there are going to be some issues. So let's just, you do this today. We roll it out Thursday, Friday. Monday, we're on telehealth. And so previous to COVID, we did 0 telehealth visits in 30 years of practice. Our first week, we did 1,600 plus. And then we were over 2,500 visits a week, probably for the next 5, 6, 7 weeks. It accounted for half of, so our business went to 50%, and then 50% of that business became telehealth. So without telehealth, if we didn't pivot like that, and so the decision was really based on 3 things. The first thing was safety, right? We wanted to make sure that we can take care of patients in a safe environment and safe for our therapists. So there was a number of different prongs to the safety, but certainly telehealth fit that. A major thing for us was access. One of the things that, physical therapy, especially by 2020, we've been trying to elevate our status in the healthcare community. And so in my head, if we're going to close down, how is that going to elevate our status? I just didn't understand it. To me, if we're going to be an essential part of the healthcare system, I thought if we could take pressure off of the emergency rooms for folks who are in acute pain with back, neck, whatever the case may be, post-surgical that still needed hands-on care, let's keep our offices open for those patients, and for everyone else, put them on telehealth. And that's what we did. And so access was our second thing. And then the third piece of the triangle for us was, we knew at some point this would, we'd be able to function better, or not that it would go away completely, but it would get better. We wanted a business to come back to. We thought, doing this would be kind of the right approach.
Great. So people know I'm monitoring the chat. So as questions come up, please feel free to type them in. We will take your questions as we go and definitely leave enough time at the end to make sure we get to all of them. So Steve, how did you notify your patients? How did you notify your staff? Did you give your patients an option? We are still open if you'd like to come in person, or you have a telehealth option that we now have available to you.
So our marketing team did a phenomenal job communicating directly with patients. We were messaging them 2 and 3 times a week. I was doing a video message weekly for all of our employees. We thought, again, my executive team is phenomenal, and part of what came out of those daily meetings was the need to over communicate right now and make sure everybody knew what our intentions were, how we're going to keep them safe. We came up with before we were asked to, we came up with an entire protocol of how to do cleaning in the offices and what happened, just all of the different algorithms. What happens if someone is exposed, and how we're going to work, and what's the cleaning going to be, and so forth. So when Charlie Baker said, you have to do, all this stuff, we had already done it. We were ahead of it. So that was my team being really, really very, very efficient. And those 2 and 3 hour meetings every morning, we've got, so not only did we get all the cleaning and safety protocols done, then my CFO and my HR director put together a plan to say, how are we going to, retain our employees that we care about so much? And so we put together a furlough program. We had to take people off salary and put them on hourly, and just figured out a way to keep them whole. I mean, we were obviously very lucky. The government was supplementing folks that were on unemployment. We were able to, get people down to under 20 hours a week so they can also collect unemployment. Those folks that were working over 20 hours, we just ate the rest of it. So our goal was to try to keep people financially whole, if at all possible, and obviously retain these great employees that we work so hard to attract.
So as we know in healthcare, patient satisfaction is unbelievably important. Have you gotten feedback from your patients about their experience with you staying open, and about their experience with telehealth?
So one of the things we did over the summer is we actually we did a survey of all of our patients, and we published the survey in a white paper, and the results were astonishing to us. Our theory was, the older folks are not going to like telehealth, and that was not the case. All the feedback we got was extremely positive and remarkable. Our arrival rate, meaning the amount of people who show up to their appointments, went up. The cost actually went down, meaning the average visit at discharge went down by an entire visit because people were staying on their plan of care. So all the things you would think about, I don't know about telehealth, I completely went 180. I went from not seeing a use case to seeing like this should be a permanent part of what we do. Now, it's not going to be 50%. Right now, we're back to kind of normal numbers, and it's about 3% of our business. But those 3%, those 300 some odd visits a week, that's really important for those folks who don't have access, who may not be feeling well, don't want to come in and infect anybody else, have trouble ambulating, whatever the case may be, we're using it. Or, if there's a snowstorm coming, we can switch people to telehealth and keep them on their plan of care. And some of the other benefits of being on telehealth is all of a sudden now our therapists have a window into our patients' world where they're having some issues. There are obstacles at home that normally we can't see, and now all of a sudden we have a window into that. And that was also a large comment that not only patients would talk about, but our therapists would say, this is really cool. We can work on their ergonomics, and we can work on all kinds of things to help them at home.
Yeah, so important. When your patient comes in and says, I have pain sitting in my dining room chair, you can now see your patient sitting at their dining room chair.
Exactly.
Live. So what resources did you make available to your therapists for telehealth when you first decided that this was something that you were going to have to make happen?
So, fortunately, our home exercise program, I think it's called Busy Track, has a telehealth module on it. So they were already used to using PhysiTrack. And what's so cool about already using it is now the telehealth, when they were doing telehealth with patients at home, they could actually bring up their exercises so the patients can see the videos in front of them. And so really what we did is, we did those webinars. Then we brought, I know some of our therapists had done telehealth privately on the side. And so I asked her to host a webinar for us, which she did, to really help our therapists, with any kind of issues they had using telehealth. And most of the issues were mostly around technical stuff, which we were able to handle. And our therapists adapted so well. I mean, if there was one word that I perseverated on, those are for the speech therapist folks out there. I perseverated on the word adaptation, be adaptable. And our therapists were unbelievable. And I think really the biggest thing for them was our communication with them, what our plan was, what we're doing, what we expect them to do. They really appreciated it because they saw all around them, PTs were getting fired. They were getting with no notice. They were getting laid off. They were, the job market changed completely. And so other than that, I'm not sure we provided them, other than the opportunity to continue to work, to take care of their patients, which, at the time I think was pretty big. Now, obviously there were some therapists that were, overly concerned with COVID, and we had to, deal with that just like we have to deal with patients. And so we made accommodations for them to do more telehealth at home, and that's fine. And so, yeah.
So your staff in general, that was going to be my next question, is how has your staff adapted?
Yeah, they were remarkable. I mean, they just, we laid out a plan and we executed the plan, but we couldn't do it without them. And so it was really like, and I've said this to you and to Christina, it's the best month of work I've had in how many years, 30 plus years of working. And, the business lost a tremendous amount of money, and I consider it the most productive time I've ever had because we had to be. I mean, we were up against it just like everybody else was. And we had to, come together as a team, as an executive team, and then communicate what our intentions were, what the plan was, and to watch our team on the ground execute at such a high level and maintain that access for patients and have good results with patients. It was remarkable. It was really, really remarkable. They adapted really, really well. We had one therapist who put together a little Instagram video on how telehealth worked. She wound up winning our core value of the award a year. I mean, it was just fantastic. So the content we were producing, then our marketing team was producing all this great content for folks at home and what they should look out for, and just educating them on different levels. Now that you're home so much, make sure you're getting up and exercising. We're sending them exercises to do at home. And it was really a remarkable time.
So I know one of the things when Steve and I had this conversation initially, and he says a lot, the word team. And we can remember back to our days in Sargent, all of our group projects that we had to do. And I know, so often we were like, another group project, and now fast forward, we're into our careers. And just how important, Steve, you work as a team. It's not just you. Talk a little bit about how did you put together this amazing team?
Yeah, I mean, I'm extremely blessed with the folks that I'm surrounded with. And when you squeeze folks, you see what they're really made of. And we got squeezed this summer. And I would say anytime you're trying to attract the right folks, being very clear what you're looking for is really, really important. And I've been, because, I've made a ton of mistakes because I've been doing this for so long. I think the one thing I'm good at is learning from those and trying not to repeat them. And, surrounding myself with folks that just really get it and really are on board and understand what our vision is and what we're trying to accomplish. We've been able to really attract an unbelievable group of folks, both on, my team here at the corporate office, and also in the field. We're just really blessed. So I think being intentional is extremely important. I think that starts with core values. We've defined what they are. We talk about them all the time. We try to live by them.
And that's how a team works. Um, So as we know, the vaccine is being rolled out in all 50 states now. So I think we're starting to see a little bit of glimmer of hope of maybe what the world might look like post-COVID. Do you see telehealth as being part of your practice? How do you see telehealth in terms of physical therapy fitting in the future? What's the future of it?
Yeah, I mean, I think we've demonstrated, and certainly we're not the only group that has, but I think we've demonstrated that telehealth is a very important part of what we do. And it's a tool that should be included in the toolbox. Payers should pay for it. It should be a no-brainer. It's something like you're not going to replace the hands-on effects that you can get, but if there's an extended period of time where you just can't get in and you've had surgery and you need somebody to walk you through your exercises and your stretches safely, it's an unbelievable tool. And so I think there's a strong push for telehealth on so many different fronts to be part of healthcare moving forward, and that's true for physical therapy as well.
Do you see reimbursement being an issue with health insurance companies post-pandemic with telehealth?
Well, I mean, if you have any history with health and with insurers, you'll know anything is possible to be an issue moving forward. I think they're hearing loud and clear that the access that we're able to gain, and take a different profession, take, therapists, psychologists, now being able to take care of patients that really need to talk to them. It's different, but it's the same. I mean, folks that are in a lot of pain that need professional care, but just can't get there for whatever the reason, there's really strong evidence building that, PT should be part of that.
Yeah, I know it's really important, when we think about people that are paid hourly, that may not have the benefit of paid time off, to be able to have access to healthcare without having to leave the workplace, having a half an hour at lunch and having your lunch, be your physical therapy appointment. So I just personally feel I'm glad to hear that you will see it as part of your future and your practice. So thinking about our recent physical therapy graduates that are entering into the workforce now, what advice do you have for them entering the profession now? And what advice do you have for them about being a private practice owner?
Well, I mean, certainly they're at a tremendous advantage being a lot more technology driven than we ever were. So, adapting to these new technologies hopefully is very easy for them, and they should see the benefit coming out, and they should explore more technologies to make, access to care and care more efficient and less expensive and all those types of things. What was the second part of that? Oh, what do I see for them in private practice? Tons of opportunities. Tons of opportunities. I mean, the population's getting older. All of the research shows musculoskeletal health should be taken care of by PTs and chiros. But if we do that, if the care pathway goes to PTs first, the amount of surgeries that are not really necessary are going to drop. The amount of folks that are getting addicted to opioids is going to drop, and the overall cost of care is going to drop dramatically. And so I think that once that push, and I think that push is coming, really gets there, there's going to be even greater need for physical therapists. So I think the future is very, very bright. I think what we do, we're a locomotive being. We need to keep people moving. And who does that better than PTs and chiros? So I think the future is very bright. I think it's very exciting. I like outpatient PT. That's not for everybody. But I think for the majority of PTs that are graduating, I think they think it's exciting and they get to work with folks and, bone and joint and sports medicine and all that fun stuff. So there's a lot to do and it's very exciting.
Yeah, I think one of the things we always say is a body in motion stays in motion, a body at rest. Why did we all take physics 105 and 106? A body at rest stays at rest. So a couple questions have come in. Can you talk a little bit more about how your chiropractors and physical therapists, do they work together, or are your clinics completely separate?
No, so the 16 offices where we have chiro, they're located within the PT offices. So they all work, in the same offices and they definitely work together. Our PTs in those offices love having the chiro there because they all get adjusted. The chiros love having the PTs there to work on whatever they need to get worked on, but really it's for the patients, so the patients have a choice and have the option if you're going to the chiro and you're going for a neck issue and you have a knee problem, you have a PT that you can refer them to. If you're a knee patient going to the PT and you have a neck issue and you want to see the chiropractor, you're right there. So there's definitely some cross, kind of fertilization that can happen, and we think for the patients it's unbelievable, and certainly for the docs, for the therapists, and for the chiropractors. There's a lot of interlearning that happens, and how to take care of patients holistically, and we think it's a great approach.
So another question came in. What is the greatest challenge and what was your most unexpected opportunity as a result of the shift to your business last March? So what was the greatest challenge and what was the greatest unexpected opportunity?
I think the greatest challenge was really deciding what to do. It was really the team coming together and just saying, we have to stay open. Here's why. We have to keep it safe. Here's how. We have to keep people employed. Here's how. Putting all that together was a tremendous challenge. That summed up my best month of work, right? And the greatest opportunity, we've had so many great opportunities. We've been able to hire so many great therapists because so many people got let go. So that's been an unbelievable opportunity. We've acquired and partnered with a few groups along the way, which has been a great opportunity. So we've been able to grow during this. So we think those opportunities have been good. A few other, silver linings. My team has never been closer. Our communication's never been better. And we've never looked at our business this tightly and this closely before. We'd look at the business on a month level, like, everything's fine. We literally look at it on a daily level now. How many new patients, how many visits, what's going on? We have a much more intense view of our business, and we're able to sustain that view. And so a lot of silver linings came out that are very, very positive.
So during this time, I know a lot of clinics wound up actually closing as a result of the pandemic and solely going to telehealth. Did you reach out to some of your top referral sources to let them know your doors were still open? How did you communicate with those that refer patients to you to let them know that you were open and you were using the telehealth module?
Yeah. So we let them know that we had a hybrid approach, right? Because if they had acute patients that needed hands-on care, we're there for them. But we also understand that it's, there's a safety issue and we're doing telehealth. So we faxed offices, those that would let us visit, we visit, otherwise we'd call them or email them. We just, again, with our communication piece, the marketing team did an unbelievable job keeping our referring physicians apprised of what our plan was and what we were doing to keep people safe.
Which is important. I mean, I think back to, post-op rotator cuff tears, post-op ACL, like you need somebody's hands on you, to mobilize your shoulder, to, make sure you get full extension in your knee. So just important that physicians know that our doors are still open for those people that, can't just be seen via telehealth. So another question came in: how does telehealth help or hinder interprofessional practice?
Interprofessional meaning between PTs or between PTs and MDs. I'm not sure it hinders, because we don't look at telehealth as, okay, someone's going to do all of their, although some do. Usually it's part of their care is on telehealth and part of it is in-house. And we don't have, at this point, we don't have any therapists that are just doing telehealth. So I don't think it hinders anybody's ability to learn from other therapists or to grow. From a continuing ed standpoint, we've totally shifted that model. Another silver lining: we've been hosting these unbelievable continuing ed programs via Zoom, and so I don't think there's any issues there.
So another question came in: given the shift to telehealth, have you explored the efficacy of remote treatment versus in-person sessions?
So again, we have not done a study based on just how, pure telehealth would be seen versus in clinic. I think our strong belief would the preference would be in clinic. Personally, I look at telehealth as just a unbelievable tool to have when folks can't and shouldn't be in clinics. And so it's I don't look at it so, binary where it's one or the other. I look at it as an opportunity. If we need to use it, we have it and we do use it. But I don't have that data to suggest, it's better, worse, same at this point.
So as your therapist schedules are set, will they see two patients in the clinic and then go into an office and have a telehealth visit? How have you adjusted people's schedules to accommodate for seeing people in person versus telehealth?
So now everybody's in the clinic. Everybody's in the clinic. And if they do telehealth appointments, they do it from the clinic.
Okay, so everybody's
unless there's a blizzard, and then they can just do telehealth from home.
Which is the beauty going forward. You'll never have to close a clinic down. You can pivot to telehealth if need be.
Yep.
And then do you let your patients switch back and forth between in-person and telehealth if they wish? How much freedom are you giving your patients?
Yeah, that's really therapist patient driven. So I'm not at that clinic level, and we're not by any means prescriptive to our therapists. If they think that it's, be good for their patient to do one telehealth at home and two in the clinic, great, or whatever the, one and one. We're not being prescriptive on how that should work. What we do is, if we see weather coming in 3 days ahead, we say, hey, you guys may want to start thinking about switching some folks over to telehealth so we can keep them on plan, on their plan of care.
So talking a little bit about just the future of healthcare, the future of reimbursement, as for those of you that don't know, Medicare reimbursement rates, January 1st, 2021 went down. Where do you see the future of reimbursement and PT and, advocating for higher reimbursement rates versus lower?
Yeah, so I think as we move towards more primary musculoskeletal practitioners, I think we'll have a better opportunity to have better reimbursements. I think it's difficult to predict what's going to happen, but I think, certainly the what we're hoping for is to create an access network that we can go to payers with and say, look, if you send your musculoskeletal patients here first, the downstream costs are going to be tremendously less. And literally, we're going to be saving lives. People are not going to get addicted to opioids the way they do now. They're not going to, unfortunately pass away on a surgical table. That just happens. It's statistically, it just happens. So if we can avoid, like way back when, if we can avoid drugs and avoid surgeries, and do things in a more natural, holistic way, it's good for the patient, first of all, and it's certainly going to be good for the, for the economy in general and the payer. So I think we've got a great case in front of us for kind of demanding more, and hopefully that that comes true.
Yeah, for those of you that don't know, just a little bit about the evidence behind manipulation. Literature shows that you have a 50% chance of making a patient with, non-radicular radiating low back pain. You have a 50% chance of making them 50% better in one visit. And if you think about how many people will go to their primary care provider with back pain and potentially, like Steve was talking about, be prescribed pain medication versus going to PT or chiropractic care, and never needing that. Letting your body use what it naturally has through manipulation, and having that 50% reduction in pain, which is so unbelievably important. Another question came in. Have you found insurance companies reimburse differently for telehealth versus in-person therapy?
So insurance companies have been, I'll be honest, they've been great during the pandemic, for good reason, right? Nobody could go to the doc, so they could be very generous because they were stockpiling money. They had to pay us some way. I'm being a little facetious. They've been really good. They, during the height of the pandemic, they dropped copays for telehealth. And they said, hey, if we normally cover it in the clinic, we'll also cover it for telehealth. So they've been great, and they've extended all those benefits, except the copays you got to pay. So we think they've been, surprisingly cooperative.
That's fantastic. Another really good question came in. Have you seen anyone in the clinic who has post-COVID sequelae symptoms that require chiropractic or PT care specifically?
So we are just finishing up. We're doing this course with Mount Sinai because they saw a ton of them down there, and so we have probably 100 of our therapists that are actually being trained specifically for post-COVID patients. And so to date, I can't tell you if we have or have not seen any yet, but I know we're all going to be trained on how to do that.
Yeah, so important. A study just recently came out either in JAMA or New England Journal of Medicine about symptoms that, professional athletes are having now post-COVID.
So this group out of Mount Sinai, they're doing this for nothing, for free. They're just educating different groups around the country so that there's an access network to take care of these patients. And we jumped right on it, and we're in the process of getting educated.
Fantastic, and so important right now. Another question came in. Would you ever see an opportunity to spin off 100% multi-state telehealth operation as a separate company?
Me personally, no. Multi-state is first of all, you're getting, when you cross state lines with anything, you're getting into a little bit of a regulatory nightmare. So I'm sure legislatively, one of the things they're going to try to do is ease up some of the regulations around state lines as it pertains to telehealth, because for instance, you could have an expert in an eating disorder in Boston and someone in California that needs to talk to them, but how do you do that with telehealth if there's all these regulations? So that's not something I'm interested in, but certainly I'm sure there are groups out there that are potentially interested.
So those are the questions that have come in. If anybody has any last remaining questions for Steve, I've really enjoyed being here with you tonight.
Thank you.
So much to learn, and just, really proud that you're part of our alumni network. For those of you that are in the Boston area, like Steve is a very important member of our, living community and also our alumni network.
Yeah, I mean, Sargent College, for me, that's kind of where it all began. My memories there. So I was at the old Sargent College, the old tire factory, which most maybe some folks on this actually remember. The level of professors there, like we spoke about, Pam Levangie and Prudy Marcos and Pat Sullivan, were just, you know, top of the profession, pushed you, you know, really top-notch education, and just, you know, for me, obviously led to some really wonderful opportunities postgraduate. So I'm very proud to say I'm a Sargent grad and a BU grad, and really appreciate being invited to do something like this, and hopefully give back or spark some interest, or hopefully just something positive comes out of it.
Yeah, we still continue to have such an amazing program. And for those of you that remember Dr. Powers, you know, not only did Steve,
If there's a medial, there's a lateral, right?
just, you know, those are the little things that, you know, for those of you right now that are, you know, everybody has a story of COVID, and, you know, some people are suffering from anxiety and depression and job loss and, you know, loneliness, just being inside for so long. And it just, you know, when Steve and I were talking about Pamela Vanjie and Whitney Powers, just, you always have a family at Sargent. Like, even though, you know, you were in the tire factory and then we went to One University Road, and, you know, now we're at 635 Com Ave, like, it doesn't matter the building. Like, it's Sargent, and we all will always have a family there.
Hey, I see one of my classmates is on here. Jim O'Donoghue. What's going on, Jim?
Hey Steve, how you doing?
Long time, man.
Man, yeah, I saw the announcement come through, and I thought, well, I got to get on this one. So
I love it.
yeah,
We got to catch up.
yeah, dude, that'd be great. Be great.
I'll have somebody on the BU and give me your contact info. I'll send you an email. There you are.
Yeah, that'd be great. That'd be great. It's fun. Great to see you. Congratulations on your business and the way you've pivoted over this past year.
Thank you, man.
Awesome to hear.
Appreciate it.
Sure.
It's been way too long. That's fun.
Yeah, for sure.
It's such an amazing connection. And I'm sure when you see each other, it was like it was just yesterday.
Well, a little
Yeah.
more than that.
Yeah, a little bit more.
Jim, where are you? What state are you in?
I'm in Pennsylvania.
Great.
Yeah.
Let's definitely connect. I'd love to catch up.
Yeah, me too. Yeah, how do we do that? Can we
I don't know. Christina, you're going to make that happen for us?
I'm emailing you Jim's email right now. I'm assuming
Perfect.
that's okay, Jim.
that'd be great. Thank you.
Good.
I'll shoot you an email, Jim.
Sounds great, Steve. Thanks.
Yep.
Great to see you.
You
Great
too.
to see you.
What a great reconnection. Well, everyone, I want to say thank you so much for being here with us tonight. I hope you're well. I hope you enjoyed our last hour. Steve, like, words can't express how thankful I am that you were here with us tonight, to give us your time and share with us how you helped to literally thousands of people in the middle of a pandemic through your clinic. So thank you for your work. Thank you for being here with us. And everybody, I hope to see you at our next fireside chat with Dr. Elizabeth Coe, who's now teaching gross human anatomy. So we can take the gross human anatomy journey from Dr. Powers to Dr. Shotland to now Dr. Coe. I hope you're able to join us for that in April. And you're in our thoughts, and I will see everybody soon. Steve, thank you again so much for being here.
Thanks, everybody. Appreciate it. Take care.
Thanks, everyone.
See you
This
later.
was great.
Talk soon.
Hey,
See you, Steve.
Thanks, Kelly.
Good to see you. Bye-bye.
Appreciate it.